4G versus 5G. 4G is the fourth generation of mobile phone communication standard. It turned our smartphones into powerful computers that could fit in our pockets. 4G offers a fast mobile web access that allows game services, HD videos, and HQ video conferencing. For 5G, it is the fifth generation of mobile phone communication standard. 5G is the next generation wireless network technology that is expected to change the way people live and work. Using separate bands to communicate, 5G is smarter, more energy efficient, and faster than the previous generations. The main benefits of 5G compared to 4G LTE are higher capacity, higher speed, and with low latency. The fastest 5G networks are expected to be at least 10 times faster than 4G LTE. The superior connectivity offered by 5G will transform everything from banking to healthcare. With 5G, remote surgeries, telemedicine, and even remote vital monitoring of patients is possible.
About 5G implementation in healthcare. So, for this video, I will cover three sections. The first one is the breakthrough. Here, I will talk about healthcare technology that become possible with the technology of 5G. The second is debunk the fear. Here, I will talk about the misconception of 5G usage in healthcare and how we can fix that misconception and how can we solve this problem and by presenting the solution. And third is how does it work. Here I will explain a detailed principle of operation for one of the technology mentioned here in the video. So without further ado, I will continue to the first section, which are the breakthrough. So 5G will create new and exciting opportunities in the world of healthcare. There is numerous breakthroughs that are previously seems unrealistic become possible with the growing implementation of 5G. So as you may know that there are a lot of technological advances in the world of healthcare that are previously limited because of internet issue and other issues that are now possible with the implementation of 5G, because 5G enables us to create something with Internet of Things in mind. So it is implemented in the world of healthcare. So one major example of the 5G implementation in the world of healthcare is remote surgery, which utilizes the technology of 5G to conduct surgeries at two different places. So as you may know, during this pandemic, people are getting difficulties in receiving healthcare, especially surgeries, because those hospitals are prioritized for fighting the COVID-19 pandemic. Here, with this technology advancement, it is possible for a patient to be put in a hospital in rural areas or other areas, while their surgeon is in another place far away. This will cut the cost of travel. This will enable people to get a proper surgery from an expert that might live in other areas, or those who are finding difficulties in doing surgeries to cure their diseases because the surgeon is only live in somewhere around the world that are far from the home of the patient. So with this remote surgery, it is actually possible to conduct a surgery without the patient physically meeting the surgeon. Later I will tell you the story about the hospital in China who have done remote surgery, that on the next chapters. Other example here includes telehealth, where you can consult with the doctors and maybe get some diagnosis on what you have, what disease you might have, and also wearable technology that allows the doctors and nurses to track your movement, track your health medical record, online and conveniently. With the advancement of 5G, everything here is possible. So now I am going to the second section of this video, which are debunk the fear. Here I will debunk the fear that might arise from the implementation of 5G. One question that people ask a lot is our data safe? Because with the rise of 5G usage in healthcare, many people worried about the safety of the data, because after all, it is saved in the internet, and internet can be hacked. It is possible to be hacked, and that are dangerous, especially if they successfully hack medical records. Medical records is a fundamental data that must be protected from potential data theft from hackers, so that people worried if they can steal medical records, that means that they can know our identity, that steal our identity and things, etc, etc. So there are three ways to prevent this problem actually. The first is zero trust approach. The second is universal encryption, and the third is orchestration by artificial intelligence. So the artificial intelligence here will detect the potential data theft by studying its behavior and then able to kick them out from the system to eliminate them from the potential data theft. So now I am in the third and final chapter of this video, which are how does it work. As I mentioned earlier, I will mention how remote surgery works. Here, I will take the procedure done by Beijing Sultan Hospital, sorry for bad pronunciation, to do a tele-robotic spinal surgery in 6 separate hospitals in China. So, the Beijing Sultan Hospital is the center of the surgery, and from the center of the surgery, they conduct surgeries in 6 different hospitals in China. So, the operation was performed according to the guideline for thoracolumbar pedicle screw placement assisted by an orthopedic surgical robot. So maybe you can see here there's a robot here. After anesthesia, the patient was prone on the Jackson table. And then the patient tracker was placed at the spinous process of 1 to 2 vertebrae cranial to the operative segment. The registration plate was assembled to the robot arm and be placed to the appropriate position in the operative field. So next is the 3-dimensional images were harvested using motorized arm. Images were transmitted to the master control room in Beijing Sultan Hospital Remote Surgery Center via the 5G network system. Here is where the 5G network system comes into play. And then the pedicle screw placement planning was accomplished on the specific software in the robot workstation. So the point is the doctors from Beijing Sultan Hospital control the robot from their control room, from the master control room, and they control 6 different hospitals. The robot surgeon chose entry point and 3-dimensional convergence orientation of the screw. Under the guidance of navigation with remote control, the guiding tube of the robot arm was moved to the locked place. Then, this is the final step. The Q wire and screw were placed along the robot guiding tube by surgeons on the patient side. Surgeons on the patient side performed the rest of the procedure of the operation. So there are 2 surgeons. The first one is the surgeons that stand by on the patient side during the operation, and the second are the surgeons who are controlling in the master control room in Beijing Sultan Hospital.
So here is the 3 ways on how 5G will transform healthcare. For the first one, it can quickly transmitting large imaging files. MRIs and other image machines are typically very large files and often must be sent to a specialist for review. When the network is low on bandwidth, the transmission can take a long time or not sent successfully. This means the patient waits even longer for treatment and providers can see fewer patients in the same amounts of time. By adding a high-speed 5G network to existing architectures, can help quickly and reliably transport huge data files of medical imagery, which can improve both access to care and the quality of care. Next is expanding telemedicine. According to a study by Market Research Future, the telemedicine market is expected to grow at a compound annual growth rate of 16.5% from 2017 to 2023. The study determined that the reason for the predicted increase is demand in rural areas for healthcare, as well as a rise in government initiatives. When healthcare systems utilize this technology, patients can often get treated sooner and have access to specialists otherwise not available. The last one, 5G is reliable, real-time remote monitoring. According to Anthem, 86% of doctors say wearables, which are a common type of remote monitoring, increase patient engagement with their own health. Wearables are predicted to decrease hospital costs by 16% in the next 5 years. With 5G technology, which has lower latency and higher capacity, healthcare system can offer remote monitoring for more patients. Providers can then be confident that they will receive the data they need in real time and can provide the care their patient needs and expect. Target 5G users in healthcare industry: doctors, surgeon, biomedical engineer, and rehabilitation. We end our presentation by showing you the 5G usage by country statistic in April 2019. That's all. Thank you for watching.